So you're thinking about microneedling, or maybe you just want to get the absolute best results from your next session? Well, you are in exactly the right place. See, the magic doesn't just happen in the treatment room, it's really made in the days before and after. We're going to break down exactly what to do to make sure your skin heals beautifully. Okay, so first let's get into the science of it. Microneedling's official name is collagen induction therapy, and it's actually a pretty cool process. What it does is create thousands of tiny, controlled punctures in your skin. Now, that sounds intense, but it's on purpose. It basically tricks your body's natural healing response into kicking into high gear, telling it to build more collagen and elastin, the stuff that gives your skin all its firmness and bounce. And really, it all comes down to that one key phrase, a controlled injury. All those amazing results you see for texture, fine lines, and scars, they all come from this one simple idea. And that is exactly why your CREP and your aftercare are not just suggestions. They are, without a doubt, the most critical part of the whole thing. You're basically becoming the director of your skin's healing journey. All right, here's our game plan. We've laid this out to make it super easy to follow. We're going to start with the pre-treatment countdown. Then we'll walk through the post-treatment timeline, talk about navigating the healing process, figure out if this is right for you, and wrap it all up with the golden rules of recovery. First things first, the prep work. Honestly, what you do in the weeks and days before your appointment is just as important as what you do after. This is all about setting your skin up for a calm, successful, and really effective treatment. Okay, here is your timeline. 2 weeks out, you want to avoid any other big treatments like lasers or peels. We don't want your skin already stressed out. A week before, hit pause on any waxing. Now, that 72-hour mark, that one's key. This is when you stop all your active skincare. So put away the retinoids and acids to keep your skin from getting too sensitive. And then, day of, it's simple. Just show up with a clean, totally bare face. The big goal here is to avoid anything that makes your skin sensitive or thins your blood. That includes things you might not even think about, like fish oil and vitamin E. Stop those about 4 days before. Sunburnt or tanned skin is a definite no-go. And this is a big one. You have to have been off Accutane for at least 6 months. Oh, and a little pro tip, shave the day before your treatment, not the day of, just to avoid any extra irritation. All right, you did it. The procedure is done. Now the real work begins, the healing. So let's jump into the post-treatment phase and see how this is all going to go day by day. And hey, don't worry, what you're about to see and feel is totally normal. The first 24 hours are without a doubt the most important. Think about it, your skin has all these tiny open channels that need to close up nice and peacefully. That means no hardcore workouts, no sun, no saunas, and definitely no swimming. Basically, anything that introduces a ton of sweat, heat, or bacteria is off limits for one full day. So your skin's gonna go through a few little phases. On day 1, you'll pretty much look and feel like you have a decent sunburn. We call that the sunburn phase. By days 2 and 3, the redness will fade, but your skin's gonna start to feel super tight and dry. Then around day 4, the peeling starts. That's just the old skin making way for the fresh new stuff. The number one rule here, do not pick it, don't scrub it, just keep it moisturized. During this first week, your skincare routine gets a major makeover by getting way simpler. You've got to put all those active ingredients on pause again. So no retinoids, no vitamin C, no exfoliating acids. And you'll also want to hold off on makeup for at least 24 to 72 hours. This just keeps those healing microchannels from getting clogged and lets your skin breathe. Sometimes the healing process can throw you a few curveballs. It's really easy to start wondering, is this normal? So let's clear up a couple of common points of confusion to keep you feeling confident while you recover. Okay, this one is huge. If you're feeling any discomfort, you can reach for Tylenol. But, and this is important, you have to avoid anti-inflammatories like Advil or Motrin. Why? Well, microneedling works by creating inflammation to tell your body to build collagen. If you take an anti-inflammatory, you're basically canceling out the signal. You'd be working against the very treatment you just paid for. If you suddenly see some breakouts a few days after your treatments, take a deep breath and do not panic. This is most likely something called skin purging. The treatment speeds up your skin cell turnover so fast that it pushes all the gunk that was hiding deep down up to the surface. It's temporary, and it's actually a great sign that the treatment is doing a deep clean from the inside out. This quote really just illustrates how quickly your skin bounces back on the surface. I mean, the deep collagen remodeling takes months, but that initial visible evidence of the treatment, it fades surprisingly fast. One day you're red and feeling sensitive, and then just a few days later, most people would never even know you had anything done. Now listen, while microneedling is an amazing treatment for so many people, it's not safe or suitable for everyone. And it is so important to be honest about your health history. So let's quickly run through the official safety checklist. At the end of the day, safety has to come first. So if any of these apply to you, microneedling just isn't the right move for you at this time. This includes being pregnant or nursing, having any active infections or skin conditions in the area you want to treat, or if you have a history of keloid scarring. It is absolutely vital that you share your full medical history with your provider. Okay, I know we've covered a ton of detail, but if you're gonna remember anything from all this, let it be these next 3 things. Let's boil it all down into 3 simple, non-negotiable rules for a perfect recovery. Here are your 3 pillars for success. First, be gentle. Treat your skin like it's brand new, because it is. No scrubbing and definitely no picking. Second, hydrate, hydrate, hydrate. Drink tons of water and slather on a simple, boring moisturizer. And third, sunscreen. This one is completely non-negotiable. Your new skin is so vulnerable to sun damage. After that first 24 hours, a broad-spectrum SPF 30 or higher is your new best friend. And that's it. By following this guide, you're not just passively letting your skin heal, you are actively taking control of the entire process. You've protected your investment and you've empowered your skin to rebuild itself, but stronger and smoother than before. You did the work, so now get ready to enjoy those amazing results.